It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Welcome, everyone, and we have a very exciting show that I feel that everyone should take the time to make sure you send out and share this show today as it is live. And if you miss it live, go to our YouTube channel, NuWellness TV with Dr. Lee, and share it with your friends and family, because we are losing too many people today. There's too many people that are sick and not being taken care of properly. We know that the industry and the medical world, what's happening with medication, and now there is a way that we can find out if you are taking the right medication that's for your genetic makeup and for your DNA. I have very accomplished guests with me today, and I am just so grateful that NuWellness Healthcare has become a part, and we do offer this exam at our clinic. So you'll be able to hear what it's all about, but keep in mind that we have too many people placed on too many medications, and we have to do something about it. And I'm so happy that the team of people who are here today are going to share how we can do that. We have to do things to start saving lives. I want to thank our Honorable Congresswoman Diane Watson, who is here. I started with her years ago when she was senator and had the health committee years and years ago, and such an advocate when it comes to health. She has a story she's going to share with us at the end of the show. But I want to thank my guest right now. I have Dr. Judith Miles. I want to thank you so much for being here. Kim Gorman, and also Michelle Beckwith. Thank you. You ladies look lovely, and thank you for being here today. I want you to sort of tell, Doctor, if you can kind of give an overview quickly on your background and why you're doing what you're doing, if you don't mind.
Well, I'm a pediatrician, which is like what I like to think of myself as primarily, but also a medical geneticist. And my work is with children and adults with genetic disorders like Down syndrome, neurodevelopmental disorders like autism, Fragile X, but basically complicated patients. And particularly at this point, I am looking at people who develop catatonia, which is a neuropsychiatric disorder, on top of these things. So we've got a lot of variables that we need to look at to
Yes, we do. Right. I'm so happy there are people like you in the world, because we really need people like yourself to do what you're doing. And I just applaud you for being who you are, and such a humble person. We have your bio on our website, so it will be on our website. But right now, we did send out a wonderful e-blast thanks to our social media person, Natasha Walker. But everything was sent out, and you have done some incredible work. I want people to really take their time to go read your extensive bio. It is truly amazing. And Kim Gorman, can you tell me a little bit about yourself?
Yes. I'm not a doctor. I'm a scientist. I'm a chemist.
Yes.
And I have worked with DNA since about 1989. Worked first on the Human Genome Project, and then later with forensics, doing DNA testing for the St. Louis Police Department. And for the last 20 years or 21 years, we've been here, and we've done just a variety of things in this laboratory. And what we've been working on for the last several years is called pharmacogenetics or pharmacogenomics. Yes. And that's using your DNA makeup to determine if medications will work for you. Many of the side effects that you hear about, or the adverse drug reactions you hear about from medications, are because you don't have the right genetic makeup to be taking that particular medication.
Yes.
And also the lack of efficacy. You'll hear some people say that, many pain drugs just don't work for them. It doesn't do anything for them. Well, it doesn't do anything for them because they don't have the right genetics to convert it to the form that makes it relieve pain. So that's what we've been working on for the last several years. And then Dr. Miles has been using this genetically directed medication management on her patients, as well as pain management patients, on patients with ADHD. It just almost any type of medication you're taking. Cardiac patients, it affects everyone.
And we've seen so many problems as we go along this conversation and questions. And myself, working in emergency medicine years ago, and people would come in with their medications if you ask them to bring them, especially in the clinic, with 30 and 35, 40 pill bottles, they bring with them. And especially our elderly. It's so sad what's happening. But now I would like for Michelle Beckwith to tell me a little bit about yourself. Thank you.
Thank you. A lot of people call me Shelly.
Almost everyone.
As I was saying, it works either way. I answer to both. I'm a scientist as well. I've been working in DNA typing or DNA testing genomics since the early 90s. I've also been in this laboratory for 20 years and I'm responsible for a lot of the development and implementation of new genetic testing technologies as they come on. I've played a big role in the pharmacogenomics, and I've worked in human identity testing as well.
I'm sorry, I didn't hear the latter. What did you say?
Oh, and human identity testing.
Okay.
So forensics and relationship testing,
Right.
And identifications, things like that.
Yes. Well, I met you through my dear friend, Keith Holman, and he made sure he mentioned that this morning, that you were the one that worked with the DNA testing as it related to, I think, a Katrina?
Yes, I did.
Yes. Yeah.
I spent about 6 months in Louisiana after Hurricane Katrina.
Yeah. I want to thank you for that. I'm sure that was pretty devastating to even work in that arena during that time. It takes a very special person like yourself to even do what you're doing. So I really thank you. So I want to
thank you.
Thank you so much, ladies. And Doctor, I want to, ask some questions as it relates to genetic testing and making sure that people are taking the right medication. First of all, we kind of want to go to basics because there's a lot of lay people that are watching the show. What is genetic testing, medical genetic testing?
Well, genetic testing is a wide variety of tests, anything from doing a chromosome test to looking at a microarray, or what Shelley's doing here. And Shelley's really the one who, when you want to ask questions to about pharmacogenomics, she's our expert who developed these tests and has really put together the whole program. So I'm sort of the person who takes advantage of everything that she's done. But these tests are very specific.
Yes.
In that they look at little snips of the DNA, little pieces of the DNA that vary between different people. So where, somebody has blue eyes, somebody has brown eyes, somebody has type B blood type, somebody has type A. Those are all variable genetic traits. But some of these variable genetic traits are part of the system that breaks down medications.
Yes.
Or converts medications from an inactive to an active form, or from one or the other of those. So it's sort of a complicated test where every single test is specific for a specific enzyme, and those enzymes that break down these medications usually break down more than one kind of medication. So what Shelley can tell us through these tests is if my patient is someone who's deficient in one of those enzymes that's supposed to break down this medication, and I use a normal dose, I look up in the PDR, and
yes.
Of course now we do it online, but anyway, you look it up and you've got, this is the standard dose, and I give somebody that standard dose. and they start having all sorts of side effects. Well, one of the reasons for that is that they're one of the variables that doesn't break down that medication into an inactive type or inactive compound, and so it keeps building up every day. When they take more, it gets like they're taking much more than they should, and they end up with side effects.
Yes, they do.
Does that make sense?
Oh, no, it makes sense. Yes, I've had a couple journeys myself because of my own health history, and I've been in 2 comas in my lifetime here. And the very second one, I was discharged on about 25 plus medications. And I've had pulmonary embolisms. And the whole thing with the heparin, back then, that's what was treatment of choice. They sent me home to give my own heparin injections. And boy, did I have side effects. So I just want to say that this was not, in the 70s, they were not doing this type of testing, or I did not receive this type of testing to know that if I was a candidate for that type of medication. I've been blessed to do so many other things on the natural side, so I'm really grateful. But, this is so needed because of the type of patients I know that you're seeing. Can you kind of share with our audience what are the most complicated cases that you have and how genetic testing has really helped them or helped you to?
Well, I'll come up with one from a patient of mine, but then the wonderful thing about Shelley in this lab is that this is complicated stuff, and it's being used now by a lot of physicians, a lot of healthcare providers. But it's like learning a whole new course or a whole new book. And Shelley's the one that everybody calls when they say, my patient has a 2D6 variable mutation, and I'm giving them XYZ medication. What should I expect? So anyway, she's the real expert who answers all the questions. I can sort of tell you a little bit about, some of my patients. But one young girl has just lots and lots of obsessive things. And I think she was driving her mother crazy more than herself, but she would take everything out of one room and put it in a closet. And her mother would go to bed at night, and she'd wake up in the morning, and all her china was taken out of the china cabinet and was in the closet. Mm-hmm. And she just couldn't kind of keep from doing these obsessive things. So I said, okay, well, let's see what we can do as far as a medication. So I prescribed a medication, one of the antidepressants that helps with compulsive behaviors. And, the first 2 days, her mother said, this is better. And then she called and said, this isn't so good. Well, she's probably just expecting too much from it. This, what we do, we always sort of think, well, maybe that's just the way it is for today. We'll think about it a little bit more. And so by the end of the week, as I was looking at her side effects, they were all the side effects right out of the book, but she was having them more extremely than most people. So we took her off the medication. Mm-hmm. And she was taking all the dishes out of the dishwasher and putting them all in the laundry room. And so we tried again, came back with exactly the same thing. And then I remembered, because I'd already done it, she'd already had the pharmacogenomic testing. This was right when we were getting started. And I looked, and sure enough, she was not breaking down this medication from the active site. So every day when I gave her another dose, it just became higher and higher blood level and caused the side effects. So we got her off that, and the side effects went away. We found something else. She's now doing, I saw her last week, and her mother said when I walked in the room, she's awesome.
That's a wonderful story, and I'm sure there are people that are listening and watching that can relate to some of what you're saying with their own families and children, because there's so much happening, and we know some of it may be due to we don't want to get into the whole controversial vaccinations, but kids have reacted a lot differently, as we know from vaccinations and other things. But as far as some doctors who want to treat the children, they'll be able to test them first. And this is what this show is all about, to really educate the public that you should have this test. If you're taking any type of medication, you should have this test done. And they can, call us. Thank you that we now are offering this at NuWellness Healthcare, so you can actually have this test done with us. But, the vast majority, like I said, people are on a lot of medication. So, doctor, as far as what would you like to share with our listening audience that you feel there's something very, because you've been in this business for so long, and sometimes I can ask you a question, but what would you like to share that would be most powerful for people to know and walk away with right now?
Well, I think this is sort of answering as a geneticist. Genetics is a field that's always advancing. So when I started out and we were doing chromosome tests under the microscope and looking at chromosomes to see whether they were all there, that was one thing. And I always would tell patients, okay, I'm seeing you in 1995 and the information I'm giving you is correct based on what we know in 1995. But now we're in 2017, and I always think back, gosh, I hope those people where some of this information has changed, or there are new tests available, or new things we can look at, come back to realize that in a field like this where the techniques are evolving and the knowledge is evolving, and we're really looking at personalized medicine where
Yes.
one person and you come up with what's best for that person.
Yes.
A new world from 1995.
Most definitely.
So people to give up when they get discouraged about things, but keep looking for somebody that's really into personalized medicine, and sometimes call it precision medicine. I like personalized best.
I like personalized because we need to tailor it to that person's need and what their body needs based on their DNA makeup, and their genetic makeup is what they would need for them. So I want to thank you so much for, and we're going to do another show here, but I want to thank you so much, Dr. Miles, for your insight and what you're doing and what you have to offer, because you have done a lot of work and you supervised and have, had an input on so many well-known establishments that I actually work with as well. And I want to thank you.
When you're old, you get to have done a lot.
Well, you're not old. And so, Kim, I know being the president, and I know you have, as a scientist and what you're doing, I just want you to share a little bit more also on what you find to stand out and what would you like people to walk away with, because this is something new for a lot of people.
Yes, I think one of the very important things about this testing is many people, particularly seniors, just quit using their medications. They'll say they took a statin and it made them hurt, so they won't take it anymore. Non-compliance is huge in that area because they're taking something that causes side effects. There are other medications out there that won't cause side effects and will treat the problem, but we have to look at your genetics to be able to see what those medications are and tailor your medications for you, and not just give you a drug that is the cheapest, easiest, fastest, the one the doctor always prescribes. You need the drug that's right for you and not the drug that's just the most commonly used or the most commonly used by your particular physician. Right. And I think by using the personalized medicine or by using the pharmacogenomic testing, it gives the doctors that tool. They can prescribe the right drug for their patient the first time without trial and error or without that patient just being non-compliant.
Right. And this is one reason why I'm into integrative medicine, and we don't really work with a lot of medications. My situation is so many people call me up that are already on the medications. This is why I wanted to be able to offer this to them so they could take it back to their doctor and say, look, this is what's happening. They come to me with a list of symptoms, and I know it's coming from a lot of the medications because they come in with a big suitcase sometime of medication. So I'm just happy we're able to provide this. Now, after doing the testing, what medications can you identify? Are you just identifying what they're currently on or based on their diagnosis?
I'm going to let Shelley answer that. There's a lot of medications. We look at what they're currently on, but then we make recommendations what they should be on instead.
Okay.
Yeah, so that's definitely a multiple level question. So, especially in cases of polypharmacy, so lots of medications.
Yes.
Things can get very complicated very quickly, especially when people are on multiple medications for the same therapeutic intent. So trying to identify those situations, and that happens because often the first medication didn't work, and so another medication is added,
yes,
and then another medication may be added to supplement that, and so that happens especially in cases of polypharmacy. So identifying that situation and trying to mitigate some of the risk associated with that, as well as including that genetic component as well, and trying to identify medications that are genetically compatible with a specific person. But then you've also got drug-to-drug interactions. What else is the patient on?
Exactly.
So we've got the genetic problem, and then we've also got, okay, my patient needs a blood pressure medication. They also maybe need some sort of antidepressant medication. Maybe they need something else too. How do I find a combination of 3 drugs that don't interact in significant ways with each other and are genetically compliant with my patient? They're going to metabolize them all properly, with the goal being that we get the expected outcome. And we get the expected therapy out of this medication. That's a pretty complex equation. It requires some complex tools to try to do medication management at that level.
Right.
So the big goal for us is to be able to provide tools that can do that and incorporate the genetic information for our patient so we can make the best choice we can up front.
Most definitely.
Or if we can't, we can shift it to a better choice.
Yes, I have shared your the package that you have sent me with a dear friend who is a nephrologist. So she's very happy. She's going to be contacting you. I'm not going to say her name right now, but she will be contacting you because she gives her patients a lot of medication. And plus, they come to her with a lot of meds. And I think to do this test, and you're not guessing, you're actually tailoring something that you know that's going to work for them. And again, the reason why I have a show of this level, and I'm not the type person who really like to see a lot of people on medication, but people come to me on them. So I like to know, like I stated before, what are you taking, and genetically, is it fit for you? Is it right for you? Are you sick because of some of the medications that you're taking? So this is just phenomenal. Again, I know I keep repeating myself, but it is very phenomenal to know that this type of service exists for people to have the test done. And you're not that expensive, I want to say, too. Not that expensive for what you're giving.
It definitely can be life-changing. I mean,
yes.
The places where we see the most impact is in the polypharmacy cases, of course, because a lot of times what people are seeing as symptoms are actually side effects of medications.
Yes.
But the other place we see huge impacts is in the treatment of ADHD, because it allows, I mean, if you talk to a lot of pediatricians who treat ADHD, for the first time, that initial diagnosis, you'll find that a lot of them, they'll say, well, I'll have to go through 2 meds most of the time before I ever get to the right one. And that typically takes 3 to 6 months of time. And so that's 3 to 6 months of time where we're actually not treating, a child who may be doing better in school, maybe participating in sports, maybe participating in other things and growing and learning in their life. So not to mention the cost of medications as well. I mean, so once you can, kind of balance that cost with a drug that actually works, everybody ends up a lot happier a lot sooner.
Exactly. Since I have the wonderful former Senator Diane Watson in the studio, I want to ask her, do you have a question for our guest here?
Well, I've been listening very intently because I've had a few health challenges, and I was listening to what you know about the body and what works on the body. So here's my question, and I understand this is going to be a topic of discussion with Dr. Lee. But when you have heavy metals in your body, I understand, and I did my research after I had the operation, a replacement of my knee on my right leg. And I understand that heavy metal microscopically flakes off and gets into the bloodstream. Now, once it's in there, can you tell me what happens with that heavy metal?
Or are you basically just dealing with? I think they're mainly dealing with drug interaction with medication. So,
you sure don't want heavy metals
no.
floating around. We think of Flint, Michigan, and just shudder. And some of them, the body is great at taking care of itself in a lot of situations. So if you stop something, it will gradually go down and it's not a big problem. Others will get lodged into places, and they'll be, particularly for young people with developing brains, developing nervous systems, can be much more of a problem. And so it's often one of the things that we want to rule out first when we're looking at a lot of complex disorders.
Yes.
I guess one of the other things for all of the syndrome type diagnoses, some of those you listed up there, there's always a whole bunch of different causes. So heavy metals may be one of the causes that is usually relatively easy to work out because you can have tests for them.
Yes, and that's what we're going to do. We're going to discuss some things that the Congresswoman, former Congresswoman, wanted to bring as far as to kind of put it on the ballot so people can find out a little bit more. But for our discussion dealing with the medications and genetic testing, it is so important that the test be done. Anyone taking medication. Now, when a person is allergic or there's some drug interaction or genetically this medication is not for them, do they get a printout? I know a lot of times patients will wear the bracelet if they have allergies or seizures. Is there some type of device that your company will give them based on the medication? So in case they pass out somewhere or have a seizure somewhere, whatever, someone, if they were taken to the hospital, they would know, do not give them this certain medication because it was not compatible for them based on their DNA.
The cards.
Yeah, it's not something that we do today. And one of the things that is so complex is that there are so many medications. And often the places that we test are actually relatively few compared to the number of medications, because a lot of our medications actually go through the same enzymatic pathways.
Mm-hmm.
But one of the things that is available is the actual enzyme information, because it's small and condensed. But today it requires that the person who's receiving it know what to do with it.
Yes. So they can just keep the list themselves on them, so they would have a copy of the medication they really cannot take. So say, for instance, a cardiac patient and a certain medication they're on really does not agree with them based on the genetic testing. They can keep that information on them. So if they were ever to be hospitalized, they could say, here, I have this information. Don't give me that information, that type of medication, because it isn't going to be a benefit for me.
Now, that's one of the things, my last thing I'm going to say is, this is really complicated. It certainly wasn't available when you had your surgery in the 70s. We were back looking at chromosomes under the microscope back then. And it takes a team. And the physician is going to know some things, but is not going to be an expert on all the genetics or which enzyme in the liver has a variant that's not breaking this down. So it takes a partnership with an organization like GeneTrait
Yes.
and someone from Kelly that I could call on the phone, and we just had a little conference this last week about a medication with another doctorate pharmacology person who, we kind of get together and say, okay, what do you think this means? Because this is something kind of new. So I would recommend to people that they, go to somebody who has resources to figure this out, because none of us will do it by ourselves.
Right. But they can have this. So basically the medications you're looking at is your cardiac medications, patients with ADD, ADHD, autistic children, your cholesterol, statin drugs. What are some of the others that I didn't mention?
Really looking at pretty much broad spectrum medications. So we're looking at pain management. We're looking at mental health. And mental health is an area where there's huge impact for us. We can make big differences quickly.
Okay.
But you're really looking at the whole gauntlet of medications.
High blood pressure meds.
Yeah.
Yes, the cardiac meds, definitely. So this is wonderful. So I have some physician referrals for you. And as patients come in more to me with their medications, I'm definitely going to have them take this test. Because I have one person, she's just absolutely wonderful, and she's bedridden, and she has been on so many medications. She's afraid to let go of any of the meds, and I can understand why. But she really I'm going to really let her know that she needs to have this test. Matter of fact, I will send her a copy of this interview so that she can see this, because she really should have this. I think this is going to help turn her life around, and she doesn't have to feel like she is just captured just in her bedroom and she cannot go anywhere. She's so isolated because of this and her medication. So I'm so happy that we're having this show.
This is a story.
Yes,
Thank you.
you have a
No,
story.
you.
Oh.
You have a case where we had a sertraline case where it caused someone to literally be.
Yes, he was in bed about 20 hours a day.
And
they had no idea what was wrong. They kept giving him more medication.
Yes.
He basically had no quality of life whatsoever, because when he wasn't in bed, he just wanted to be. He didn't want to go anywhere, didn't want to do anything. He got up, he ate, and he went back to bed.
Right.
And we tested him about 1.5 years ago. We found out that what he was taking, he should not have been taking. We were able to put him on a very low dose, or able to have his physician put him on a very low dose of another SSRI.
I don't remember, but
and he's done wonderfully. He's back to being a normal person. He was back to being a normal person within 2 weeks.
My goodness. And I want to say,
changed people's lives.
That is wonderful. And thank you for sharing that story. And I want to thank you, Dr. Miles and Pamela Beckwith. I know you have a nickname there. And Kim Gorman. I want to thank you so much for being here today and sharing this wonderful information. If anyone have any questions in regards to you want your loved ones or someone to have this test, please do not hesitate to call our office at 310-419-4300. I will put you in contact with this wonderful team here, and you can start being tested yourself. So I want to thank you so much for being here today. Thank you for your time. Thank you. And Congresswoman Watson, we're now going to talk about the heavy metal and what you want to do with legislation as far as people should know. So why don't you share?
Well, just by way of background, for the last 35 years, I've been in elected office and out of my base, meaning that I had to fly to Sacramento or fly to Washington, D.C., or fly across the Pacific Ocean. So I pretty much wore my knee joint out. And you were one of the people that I used to come to early because you were able to say your body needs.
Yes.
And it wasn't always the medication, that your body needs this. And I found out that I was allergic to several things.
Yes.
Now, every doctor's office that I go in, if you are a new patient, you have to make out a form, and you do have to list your allergies.
Yes.
And so any kind of medication I would take would be void of these things I was allergic to.
Mm-hmm.
And I thought that was standard procedure when you go to a new doctor. Well, what I found out about you, Dr. Lee, is that you dealt with vitamins the body needed.
Yes.
And not the medications.
Right.
And I found out that I was allergic to penicillin. And I have worked for the Department of Army overseas, and boy, they put everything in your body.
Yes.
And I became allergic to penicillin, and I found out that that's what they use for pain, that's what they use, so on.
During that time, it was the number one medication.
Yes.
And not anymore. And that's why we're all resistant to so many things now.
So what I wanted to do is that I wanted to be sure that when you are having surgery or
Yes.
having a replacement of a joint or whatever,
Yes.
that not only does the doctor talk with you, but when you made out that form and you told what you were allergic to, I thought whatever they would replace the joint with, they should test it against whatever the substance is.
Yes.
Test it against your own body and see how you react to that.
Most definitely.
So if I were carrying legislation, I would require that not only do you sign for the surgery, but you should always have the discussion with your doctor whether that medication is something that the body can tolerate, and whatever they're going to use to replace your joint with,
Yeah.
whatever,
Find a
needs
way.
to be tested.
Needs to be tested. So you
Yeah.
know that you're not going to reaction because, you know, it's bad enough to go into surgery and then to have to go into surgery and have it removed and have something else placed in your body if
Yes.
you make it that far.
Yes.
And you were not the first person that I've seen that had a reaction to that particular heavy metal.
Yeah.
And it was pretty an ugly rash all over this girl's body from that, along with some other complications, that she had to go back into surgery and have it removed. So people were not, and they just think, oh no, titanium and all these other things, people are not going to have a problem, but a lot of people do. So we're working on products for heavy metal detoxing, but I think definitely people should be tested. And we're going to bring you back again so that we can really go into more topic on this, because I know we're going to bring you back once you talk to our powers to be to get them to put this on the bill, because it's so important. It's so important.
Well, I'm just so pleased that I know you, and you have helped me along the way. And I have gone back to my surgeons, and I have said to them, you know, this is how I'm reacting. This is what is happening to me. And they just look at me and...
Exactly.
Yeah,
I know.
And I thought I would have it taken out, and I asked my internist, and he said, no, I wouldn't.
Okay. Well, now we're going to make sure that you're doing something, let me know. And I want to thank you personally while we're on the air for being one of our spokesperson for NuWellness Healthcare. And also, we'll have another show on this, but you are our spokesperson for women with urinary incontinence.
Well, you know...
So, but we don't have time to go into that because we're going to have to move on because the show is wrapping up. Yeah. You're going to be back again. Because
I just want to say thank you.
Oh, you're welcome. Thank you. Thank you. Thank you so much for being our spokesperson. Now we're moving right into the segment, Dining Out Healthy with Dr. Lee and Marie. We had a great time visiting a wonderful restaurant, and Marie is going to take it over from here.
Good morning. Thank you, Dr. Lee. Yes, we did. And actually, the beauty of it all, it was just really down the street from the studios here.
Yes.
So as I do research and trying to find places that are convenient and local as well as healthy, Veggie Grill, who's been around since 2007.
Oh, yes.
They originated in the South Bay, but their first location was in Irvine, California. And the co-founder, I was just reading about it, was the person who wrote about the accidental vegetarian. And so not being a vegetarian himself, wanted to create something that was healthy, that was plant-based, and that was good for other people. So the beauty of it was we just kind of walked down the street. We got some good exercise.
Yes.
And we had some delicious, tasty meals. We had the crew with us as well. So
and people can Google the Veggie Grill because there's one almost in every city.
There
which is wonderful.
It's wonderful
Yes.
because it's, even though they consider it a fast food chain, but it's a healthy fast food chain.
Exactly.
And so wherever you go, the food is made right there on the spot. It's fresh, it's plant-based, and it's so yummy delicious. This was Jarvis's meal. It was the soup. He had a minestrone soup, and and the cauliflower, which fooled everybody. Everybody thought it was actually fried calamari, and it was fried cauliflower with a delicious, delicious curry dipping sauce. We had the vegan, healthy red beet burger,
Yes.
which was,
Oh, my goodness. That was
melting in your
amazing.
mouth, off the
Amazing.
chain deliciousness, with grilled onions. We had the organic carrot cake, which was our little treat that we got to share.
Yes,
at the
we
end.
did.
We do get to treat because it's important also, because when you're going out, and it's nice to have a healthy dessert and something,
Exactly.
and you can share it. You don't have to eat the
Exactly.
whole thing yourself.
And then you asked the question too, was about gluten. So if you have
Yes.
if you're gluten intolerant, ask those questions. Even if you're going to any restaurant, you want to ask those questions.
And actually, this restaurant, that this menu specifically actually has a lot of the ingredients right there, and it says it explains it, so you don't have to ask a lot of the questions.
Yes.
And they make it right there as you're standing in line. It's fast, it's convenient, it's fresh, it's healthy. The ambiance is gorgeous. I mean, you just feel like you just feel good going in there.
Yes, you do.
You do. So it's always been such a wonderful experience to.
It was a wonderful experience too, and we've had experience in a lot of places, and it didn't take a long time to bring us our food. I don't hate to go somewhere and you got to wait a long time, because those anxieties sort of, and when you're hungry, it's like
Especially
bring
when
it
you're
on,
hungry.
bring it on. But it's a good balance kind of meal for you, especially taking children places, especially the fried. And it was lightly fried, so it wasn't, you don't have to worry about carcinogenic type of
because the kids love their little
foods
nuggets.
because so
Yes.
it was very good, and it was very tasty. So they had a variety for the entire family to sit and have a nice meal.
It is, and the service has always been, everywhere we've gone, we've had the most wonderful service.
Yes, we have.
Regardless of what we're doing, the service has been really nice, and people have been very generous and just very warm and welcoming, and I really enjoy that part of it.
We have a great time. We are visiting a restaurant today, so
Yes, we are close by,
very close, across the street.
across the street. You'll get
You're
to
on
see that.
Sunset, so
Yes.
just want to thank our sponsor, which is NuWellness Healthcare.
Yes.
And I mentioned NuWellness throughout the show because we are doing the genetic testing. Then I'm so happy we're with this wonderful company, and our title today of the show is this Personalizing Your Genetic Testing. I mean, you have to really personalize your testing. This is advanced testing that is so powerful. So it isn't something that just go to a lab and get some lab result back, like doing a culture and sensitivity. Some people do know what that is, but this is much more involved. So I'm just so grateful for the guest I had on earlier. I am so eternally grateful for our former Congresswoman Watson, Diane Watson, for being here. You're going to be coming back again, because we have to do a show in depth on urinary incontinence for women, because there's too many women being affected. And my wonderful co-host for Dining Out Healthy, Maria, you're just phenomenal. And
So are you.
thank you so much for taking the time to go and gather up all the information to bring it back.
Thank you.
Thank you so much. Thank you. So I want to thank everyone for tuning in today to the NuWellness Health Show. Again, please share this show with everyone that you can. And keep in mind that your lab work, if you have friends that are on medication in family, can't say I'm a real big advocate on medications, but if you have family and friends on medication, we have to know, and you have to know if they're taking the right medication, because so many people are so sick and they've been inundated by too many medications. Call me. I don't mind sharing it with your primary care doctor. So maybe it's something they want to add to their clinic themselves. But each one teach one, and please share this video so that we can have the healthiest, productive life as possible. And as I always say, before the show ends, repeat after me. I am. And knowing that the I am is so powerful. So grateful.
So grateful.
that I am a magnet
a magnet
for miracles.
for miracles.
Everyone, please have a wonderful, safe, and prosperous day. Until next week.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.